All right. Well, we'll get started in the interest of everybody's time. So, as I said, I'm Carol DeBenedictis. I'm the chair of the APDR Roundtable Committee, and this is one of our monthly webinars. And I'm thrilled to introduce Dr. Tara Catanzano from Bay State Medical Center, who's going to be leading and organized this roundtable on skills for program directors. What do they need to face current challenges? Thank you, Tara. I'll let you take it away.
Thank you, Carolyn, and welcome everybody. I think that this is a really important topic as we move into training the next generation of radiologists, and I'm delighted to have three experts to discuss the skills that they have found that they've needed, and maybe some that have morphed during the time that they have been in these leadership roles. We have from Vanderbilt, Dr. Erin Cooke, who is a associate professor in abdominal imaging section, who has had two turns as being program director, once as the co-program director of the diagnostic residency at Virginia Mason Medical Center, and now as the program director at Vanderbilt. So welcome, Erin. We will have coming onto the line in a little while, Luke Wilkins, who is actually interviewing at the moment, as I'm sure all of you feel that pain. So he's going to be coming on in a little bit, and he's going to be representing our DRIR colleagues. He's an associate professor of radiology and medical imaging in the Division of Vascular Interventional Radiology at the University of Virginia, and he is their program director there. And finally, we have Jessica Freed, who is representing our fellowship colleagues. So she's an assistant professor of radiology at the University of Michigan, specializing in abdominal radiology. Way to go, abdominal radiologists. And she is the fellowship director at the University of Michigan. So welcome to our speakers. I'm really encouraging people to use the Q&A function to ask any questions that our audience might have, and we will have some presentations and open this up for a robust discussion. So welcome everyone, and thank you. Erin?
Fantastic. Thank you so much for the warm introductions, and really happy everyone's here. I can appreciate what a busy time of year it is, interviews, 6-month reviews and all that, a lot going on. I've been talking so much, my voice is a little bit hoarse, so hopefully it stays with us all. I'm going to share my screen here. Okay. Should be good to go there. So because of all that's going on, you may feel a little bit like this. This was an image generated from AI. I can't remember the exact prompt, but you kind of get the idea. I think this is sometimes how we feel as program directors. So dividing this into our three parts here, things that I can bring from just my background and general characteristics that I already had going into the program director role. Not running, but the resiliency that comes with doing some of these other activities. So I am a marathoner. At the time, I'd done 5 Bostons. Now I'm up to 13, which is kind of a crazy thing, but that's just a part of my being, that I stick with things if I decide I'm going to do it. This has been talked about a lot in the popular media. Maybe some of you have read this book. If not, it's definitely a good read, worth thinking about, because as program directors, we often kind of feel like this. There's just a flood, emails, all sorts of fun surprises, needs we're not expecting that are kind of constant. Kind of feels like death by 1,000 cuts, coming at you, just all sorts of unexpected fun things, right? So if you have that resiliency, which again, may not necessarily even come from medicine, it may come from other areas in life, other experiences, I think that provides a really strong foundation. Something that surprises people sometimes, since I am known as the arts person, I was an art major, people kind of think that I would not be really into having lots of organization and structure to how I do things. I actually really like being organized. I think it's very important to have ways that you structure your year, your month, your week, and that you share that with your team as well. It's really hard to ask other people to be accountable if you're not on top of things yourself, of course. And also part of this is if you have a system for organizing, and I'll talk about this a little bit more later, that lets you offload all the thoughts running around in your brain. So you can really keep your eye on the bigger picture and focus on those things that are important, because it's really easy to get stuck in the weeds of the 150 things that you have to do. The other thing that has really come to me in a very natural way is that while I am introverted, I have long been the, what should we say, social instigator. I was a resident advisor as an undergrad for 3 years, medical school residency. I was always the person who was organizing group events. I love doing that. So while I have times like when I'm on my cat here, I want to kind of just, curl away. I do love getting people together. And that has helped, especially lately with folks being spread out across radiology, to build social cohesion, to have that sense of community, identity with our programs and department. That really is important. Because the residents said, even when they're on call, they have kind of that relationship. So if they're stressed out, they can call, phone a friend, and they know that we all really care about each other. I would also say, as a program director, I think it has helped with making, I hope, me seem more approachable, and that the residents and our medical students too can see that, yes, I have an outside life, I'm a real person, that there's some ability to understand some of the things they may be going through, so that has translated into benefits in multiple ways. So some things I was maybe not great at, but have worked on over time, especially given I've had a second chance now to be a PD, is having more confidence to speak up when needed and also to negotiate. And this can be challenging because sometimes you're having to speak up to people who maybe are quite higher above you on the food chain. And right now, there, of course, are many things going on in our field as a whole, lots of shifts. And there are times when we really have to advocate for education to remain a focus, given the pressures on volumes, all the things I know you all are very well aware of. But that is part of our role too, is to be an advocate for our learners. So you have to hone that ability to speak up and recognize when it's important to do so. So this gets at, it's very easy to think you've told somebody, what the rules are, what the expectations are, but they don't necessarily hear you. So I have worked on communicating in different ways over the years. Some things, yes, can be put in emails, but sometimes you have to send the email, you have to have the meeting, you need to have a listening session. Some people need text reminders. So lots of different ways to communicate. And often it feels like you're over communicating, but that's kind of more when you're hitting it right. I found you can almost never over communicate. Your team is so critically important. You cannot get everything done, of course, all by yourself. So your team will depend on the makeup of your institution, the size of your program. You may have multiple APDs, you may have one, you may have none, you may have multiple program coordinators, but I would also include other people, of course, your vice chair of education, maybe if we're on the DR side, your IRPD and the fellowship PDs, your GME team. If you have a curriculum committee, they're also part of your team. Of course, folks in the sections, your section education directors, they're part of your team. So figuring out how these different groups are going to interact, how you're going to communicate with them. Are you going to have regular meetings? Do you have informal check-ins? If you send somebody an email, do you want to reply like, I got it, I'm all over it, thumbs up? Or do you not want those extra emails? People have different preferences. So having a sit down at the beginning of either the year or the start of that working relationship can make a huge difference in efficiency. Because one of the things is people often are really trying to help out, and it can be easy to duplicate work, to overlap. Everyone wants to jump in and fold the laundry, right? But having it really well defined and clear lines of communication, that way, again, you can offload some of these things from your brain because you know that that's going to be taken care of by your program coordinator and that they are reliable. One way to do this, and I have no stock in Todoist or any other interest, is to have some type of task manager or project manager. And so this is the one I use, Todoist. It has many features. It's fantastic. You can share projects with your colleagues, so you can work on things together and check off things and assign tasks to people. Lots of features. I could spend an hour talking about this, so I will move along. If anyone's curious to learn more, I'm happy to talk about it in a different setting. Some things that I am still working on or wish I had. I am terrible at this. My work bleeds into my outside life very much. And probably this is something many of you also recognize too. If anyone is an expert at maintaining that sort of balance that's more appropriate, I want to talk to you so I can learn from you. One way I've been trying to get at that is to be more selective in the things that I say yes to. It's very easy to say yes in the moment, to be a people pleaser, right? And to help me with that, I actually crafted a little email template. And sometimes just having those words does help to say no or to pass along an opportunity to somebody else. I am a impatient person. That's something I've been working on. Not everyone gets things done or sees the need to do things in a certain time frame. So I am working on readjusting my expectations. There are many paths to success, and I try to keep that in mind, because it's easy sometimes with all these things we have going on to get very emotional, but to step back, to really appreciate how lucky we are to be able to be educators and mentors to our amazing residents and also our medical students. So just maintaining that focus on the vision can make a big difference during times of struggle. And the third thing here that I'd really like to work on is having a better sense on locally reading the room, you could say, trying to figure out what's going on, but also figuring out how, looking forward into all the changes that we have going on in radiology, how I can help our programs and department really adapt to that environment. Something that I see as being very helpful in this process is having a network of folks, which certainly would include program directors, the APDR, but also many other networks out there in the radiology world that really complements what we do as PDs. So in closing, I just want to include my email. I'd be happy to discuss any of this more with folks offline, or if you have questions about anything, please do reach out for unrelated things as well. And I have a little section on resources. I think I'll save that for later, because I think we're going to talk about that later as a group.
Perfect. Thank you so much, Erin. I think that was a fantastic talk, and I'm actually going to try and ask the group to come back and talk about maybe some of the your challenges, that things you're working on. Maybe they can provide some of their strategies for that. I see that Luke has managed to join us, having been sucked into yet another interview day. So I'm going to welcome him and ask him if he is ready and able to go ahead and start, so that we can work our way through the residencies before we hit fellowship. Are you ready to go, Luke?
Sure, I'm ready to go. I will say that was a very hard act to follow, Erin. That was a very good talk. I don't have any slides to present. I just have some notes written down, so I hope that that will be okay. But I feel like I've learned so much about. I haven't met you before, Erin, but I feel like I know so much about you, or at least about a lot of your cats and dogs. So, are those all your animals?
Yes.
You have a small zoo over there.
Yeah. No, it's kind of a crazy thing, and they're so active. It feels like more than 3 animals. It feels like, yeah.
That's
they're always getting into stuff. Yeah.
No, great pictures. I love it.
Thank you.
So first off, thank you all so much for having me. It's great to be here and talking with you all kind of about transitioning from being a faculty member to being a PD and skills you had to incorporate. So as Erin went over, I kind of broke this up into skills I have used, skills I had to develop, and skills I wished I had. And so skills I have used during my time, I feel, maybe this is incorrect, but I feel like I am a good judge of people. I feel like I can, in interviewing applicants, I feel like it's been a little bit more challenging over Zoom, but I feel like I'm able to get a good sense of a person's motivations and who the person is, and for not to be too crass on it, but get a good sense of their level of BS. And try and cut through that to determine if the type of that applicant would be a good fit with the team that we have here at UVA. I guess I should have started with that. So my name is Luke Wilkins. I'm a UVA IR independent and integrated program director. I've been here for 10 years, and I've been the program director for about 4. So I've used that skill a lot, especially in the interview process, in the interview season in which we find ourselves, and that's been a good skill that I've used. Another skill that I've used is that I was a anthropology major in undergrad, which you don't see a lot of in the medical community. But it was a cultural anthropology major, and so I had a lot of experience in taking classes on different cultures and developing a good sense of cultural appreciation, and especially with regards to cultures that are very different from my own. So I have used that a lot over the course of being program director, to get a good sense of someone's motivations, why they're doing certain things the way they are, and how their culture or their background can impact the decisions that they're making. And it makes it's really kind of helped me to get a better sense for our residents, and kind of help them move along their pathway of their training, and make sure they're maximizing their education while they're with us here. The third skill I would say is not really a skill so much as an experience, but my wife is a lawyer, and she went to law school while I was in residency. So I went to law school by proxy. And by that, I mean, she's really, really good at arguing and breaking down the things I'm saying into making sure that they are coherent, and that they follow a logical argument. And so because we've had a number of these discussions, I think it's really helped me when I run into issues with faculty or run into issues with residents, to make sure that my communication is concise and clear, and that I'm not dancing around topics. So having her as my wife has definitely helped me be a better program director. Skills that I have had to develop, like Erin, my patience is very poor. So I've had to develop a lot of patience in my role. And I think especially when you're going through med school and in residency, I was used to things happening in a certain rhythm. When you're in residency and you're going from prelim to first year, things change. When you're going from first year to second year, you're kind of working in that yearly annual season. And then when you become a program director and you're trying to institute change, it doesn't happen in that rhythm. It happens on a much slower rhythm sometimes. And so I've had to become a little bit more accustomed to that, and develop a little bit more kind of perspective on the timeline for change, especially when it comes to instituting change within a large organization. Also, I've had to develop patience in dealing with things that are completely outside of my control. One of the ones that is the biggest example I would have is things that are outside of interventional radiology and outside of the Department of Radiology. This is particularly relevant to our residency program because we're a true categorical program. So our first year, our PGY 1 year is outside of radiology, and it's predominantly with the Department of Surgery. But that is sometimes outside of my control, and I can influence that, and I can help change those rotations. But it is, for all intents and purposes, kind of outside of my control. And so, figuring out ways that I can influence that, and still having patience to know that they're dealing with their own residency program, that has been challenging for me, and has forced me to kind of figure out different strategies and techniques for dealing with those. Other things outside of my control that I've had to have patients dealing with is the kind of environmental factors that impact our residency. As an example, I'm not sure if anyone here is kind of affiliated with interventional radiology at all or understands the kind of the complexities of it. But as we have transitioned from being a fellowship program to being an independent residency, the residents or the medical students rather that apply for interventional radiology for an integrated program, the ones that do not match, it is challenging for us to keep them interested in interventional radiology during their assumed diagnostic radiology residency. So a large portion of those people end up not actually going for an IR fellowship, which is interesting, and there's all sorts of theories as to why this occurs and some survey data regarding it. But as a result, we've seen the number of applications for independent IR residency going down. As I'm sure you're familiar with, the independent IR residency is akin to the IR fellowship. So our numbers of applications nationwide have been going down. So figuring out strategies on how to fix that and how to deal with that and front load more integrated residents, instituting that change takes patience. It's hard to say like, yes, we're going to start accepting more integrated residents and then snap your fingers and it happens. There's all sorts of reasons why you can't do that. And I've had to learn to be patient with instituting those change. Skills that I wish I had. I wish I could predict the future. That is the main skill that I wish I had. But in the absence of that, I wish I had more patience. And was better able to kind of deal with some of those challenges that I was to. Because even though I've developed some patience, it's still not anywhere near where it needs to be. The other skill kind of I wish I had, it's sometimes I have and this is probably a personality thing, but usually if there's a problem that I'm in a group and I'm part of a group dealing with a specific problem, if there is someone who gets more emotional with regards to that problem, I usually take the exact opposite approach. I have a kind of a yin-yang approach to that, whereas if somebody is very emotional about it, I try and make sure that they're balanced out. Likewise, if I think that there's a problem that's very pressing and no one is upset about it, then I get upset about it because I'm like, why is no one else worked up about this? This is ridiculous. So I think that having that balance and providing that leadership in a more balanced fashion would probably be a benefit to me. But again, that's just a skill I wish I had. So that's all I have in terms of answering those three questions. It was a very kind of general and overview, but happy to get into the weeds if anyone has any specific questions.
Awesome. Thank you, Luke. I'm hearing a common theme of patience. We're going to come back to that, I think, in a little while. We'll see if Jessica has the same thread along her talk. So I'm going to ask her to hop on and share her slides, and we'll all come back again for discussion. Again, reminder, just put any thoughts or questions you have in the Q&A, and we will address them in our discussion.
Thanks so much. I do have to say that this is not the first time that I've heard the advice to just go ahead and marry a lawyer as a radiologist. So I think that, I made a mistake. I married a hospitalist, but I wish I had this advice a little bit earlier in my career.
10 out of 10, highly recommend.
Thankfully, we have lots of friends that are lawyers, so we get a lot of the experience that way, I think. So thanks so much.
My husband's also a lawyer, actually.
Sorry, and my dad is.
Oh, that's very funny.
Perfect. Thanks so much. So I'm just going to kind of round out this group a little bit as a fellowship PD. And everybody's kind of taken the pathway of talking about skills that they have or didn't have and have developed over the PD experience. And I'm just going to basically say skills that I think are critical to being a fellowship director. I make comments on whether I feel that I have those skills or not, but I kind of just lump them together because I think it's really a work in progress. These are not skills that you nail 10 out of 10 every single day and in every single conversation with each fellow or in each encounter. They're kind of things that wax and wane. And I'm sure everybody on this call has had experiences that they've walked away from and thought, wow, I wish I had done that better, even though I did do better the day before. So I do want to talk a little bit about the differences between being a fellowship director and being a PD. I have never been a diagnostic or IRDR fellowship director, but I have been program director, but I have been a fellowship director, and I was a chief resident in my prior experience as a resident. So I get a little bit of the experience. I think I understand some of the differences. And, I think that being a program director, you really are dealing with this nature versus nurture situation where you take medical students that are probably very high achieving, have ended up in radiology, and they're kind of finding themselves in that specialty. And it's really your job to take them from that stork situation and get them that yo-yo ma level cello practice so that they can become experts at kind of figuring out what their next steps are and to feel that radiology is a home for them. Whereas being a fellowship director is really about putting on those final finishing touches to a beautiful and elaborate cake is the way I think about it. So hopefully by the time that they've gotten to the fellowship, obviously they have a lot of learning left to do, but they've gotten kind of some of their, they've gotten their sea legs under them, and you can really focus on, making those final adjustments to get them ready for independent practice. And this is actually a slide that I take from my fellowship orientation with the fellows, because I think it really typifies how I feel about the fellowship director role. And I tell them, my role for you, my role as your program director in fellowship is to be your protector. I am going to be the mama bear in situations when it calls for that. But at the same time, I'm also going to be your coach, and I'm going to be hard on you because I'm kind of the final step before you have a real boss that isn't necessarily going to do the mama bear and the protective tiger situation with you, and you kind of have to play this dual role quite a bit as a fellowship director, I think. And not that you don't as a program director for residency either, but I do find myself having to play this sort of role, being Bill Belichick a little bit more than I think I would have anticipated in the fellowship. So I want to talk a little bit about some unique benefits and challenges to directing a fellowship. And benefits include, it is a short duration of training. So most of the radiology fellowships are 1 or 2 years. And so that can be a blessing in many ways. As a fellowship director, I kind of know I have a year-long cycle, and I kind of get these people to where they're supposed to be in that year. And I have, the discrete time points that I know if we're not hitting our targets by that point, I need to go into remediation plans and whatnot. And it kind of gives you the opportunity to start fresh every single year, which is, I think, nice in some ways. Ideally, you also have mature trainees that are coming in and motivated to learn and push themselves. I say asterisks, hopefully, on this. Obviously, there are some people that get into fellowship and they're not really kind of in that motivated headspace. But a lot of times if people are choosing, especially in this current market, to go into fellowship, it's because they think they have more to learn. They know they want to learn more, and they really want to be prepared for that future employment opportunity that they already have lined up or are looking for at the moment. And this creates a really nice situation where you can take somebody that's eager to be a sponge and really help them to get across that line. Challenges include that it is a short duration of training. So, if you have a fellow that's struggling, it's harder to get them kind of up to speed and to give that time to succeed in that year or sometimes 2-year duration. And you also have people that come in those first 2 or 3 months, they're like, oh man, we have a lot of work to do here, or, oh, they're doing great. But it can be really challenging to sort of pivot very quickly as a fellowship director and make sure that you have, things in place to get each of those fellows to where they need to be by the time that they graduate. I also find that fellows have kind of an interesting experience when it comes to feedback and sort of setting their own expectations from day one. And it seems to be pretty different from the residents that I work with. And what I mean by that is a lot of fellows come in, and this, I thought in ways I did think it would be gendered in some ways. I thought that there would be, a lot of like imposter syndrome sort of stuff, but almost across the board, I find that fellows are really hard on themselves, and they kind of come in day one of fellowship feeling an expectation that they're really putting on themselves, that they should be better, they should know more, they shouldn't be making these mistakes. And so one of the most common tropes that I find myself saying throughout the fellowship year is, you are here to learn. Don't be so hard on yourself, don't apologize, just learn. Because it is something that they really put on themselves. And that really ratchets up in the second half of the year or the second half of the fellowship, where they're starting to look at that finish line and know that they're not going to have that safety net anymore that is training. And it really creates a kind of highly emotional and charged situation So that, you know, I've had many people cry in my midterm feedback review sessions with them, not just like because they're getting harsh reviews, but because they've been so hard on themselves. And so that's, you know, a different sort of mindset and approach that I have to think about with them, as opposed to residents who can obviously be hard on themselves. But I think that time duration and sort of the expectation that this is not it, this is the final step, can be helpful in sort of thinking about training and how training works a little differently. Another challenge is obviously balancing a balancing act of the faculty and fellow interests. So somewhat unique, I think, to fellowships is that residencies, you know, they're oftentimes, hopefully, the crown jewel of your academic department. And a lot of the residency related things, it's like, do not touch. And you may have to still obviously have some tough conversations with leadership, chairs, division directors, whatnot. But it's oftentimes a do not touch situation, I have found. And hopefully it's true in many of your institutions. Fellows, oftentimes, especially if it's a non-ACGME program, you know, the fellows are kind of in this gray zone where they do really make a difference in how a faculty day member can, how a faculty's day can go. And it's it kind of flips the service sort of role in a lot of minds. And so, you know, obviously our fellows are there for us to train and teach and help. But there's also this sort of, you know, they're kind of our colleagues, they're becoming our colleagues. And it can be really challenging when I have, you know, a division member say to me, like, it's really hard for me to be without a fellow on X, Y, and Z service, which I completely understand because I feel the same way. But I obviously want to make sure that my fellows are having the best learning experience that they can. And so sort of balancing those needs of our faculty with the needs of the fellows is one of the more challenging things I think about being a program director for fellowships. And then support and admin time. And I think I don't think anybody really directly mentioned this. This is an issue for everyone. And it's not unique to fellowship directors, but I will say that if you're a non-ACGME fellowship program director, the amount of time and sort of administrative support that you get for that fellowship is extremely variable. And likely inadequate because it's not necessarily scaled based on the size of your program. And I'll tell you that when I started as fellowship director, I laughed at the amount of extra kind of administrative differential I got in my paycheck. I was like, great, I'm getting, I think it was like $120 per paycheck to work with the fellows, which that's not the reason I'm doing this, but it was kind of hilarious to me. And I think I get 8 days of administrative time for the entire year for working with the fellowship, 3 of which are consumed by sort of recruitment activities. So it's a tough landscape out there, especially in the non-ACGME related fellowships for securing that support and admin time. And so to move into the helpful skills, you know, I think a lot of these were already touched on by the other speakers. And so I just want to address them briefly in terms of how they relate to the needs of a fellowship program director. So having excellent communication skills is paramount. And, you know, this may be as simple as, you know, understanding that when someone is coming to you for something, they may not necessarily express it in a very straightforward way, especially for fellows and or program or fellow colleagues. So I find myself having to do a lot more extraction when it comes to communication than I was expecting in this role. So I think many of my colleagues, you know, they may have really wonderful or some constructive feedback comments about fellows. And I actually have to really say, like, please let me know it's not, because I think people don't want to complain. They know that you have a lot on your plate, et cetera. And same goes for fellows. I have to constantly remind them that, hey, I'm here for you. You have my ear. I'm happy to speak with you at any time. And, you know, I think one of the things that really helped me to become a better communicator was an experience that I oddly had at Chief Resident Finishing School, which is like a little program that ACGME does. And I still remember they had us do this exercise where they put a chair in the middle of this room and they asked you to verbally describe what you were seeing. And then they had everybody kind of read their answers out. And I was absolutely and enormously shocked by how differently each person described looking at the same exact thing. And I mean, there's lots of different examples of this, I'm sure, that you've been through in leadership summits and stuff like that. But it really impacted me because it's really hard to inhabit somebody else's experience. And I think a lot of relationship building with trainees, whether you're a program director or fellowship director, really comes from understanding that difference, that different lens that the person you're working with comes to the conversation with. And so I have to really adapt my communication style depending on which fellow I'm working with or which faculty member I'm working with when it relates to program administration. Approachability, this is kind of something I've already touched on in the communication bit, but I really want to make sure that my fellows know that they can come to me with anything. And I want my colleagues to know that they can come to me with anything. And the same thing for the residents, because our fellows do teach quite a bit. They work with the residents quite a bit. And, making sure that I am an open book and have an open door policy as a human being is really important to the success of me as a program director. Organization, I absolutely love to do this. One of my mentors was Petra Lewis when I was a medical student, and she got me hooked on it to do this very early. I've unfortunately made the transition to Microsoft To Do because it's integrated in my PC, Microsoft PC world at the hospital. So I don't love it quite as much as Todoist, but I think staying on task and being organized is absolutely critical. I actually have a Excel spreadsheet where I have broken down by month all of the activities, administrative activities that I have to accomplish for the fellowship so that I stay on track throughout the year. Because there are just kind of a lot of little things. I administrate the fellows participating in tumor board, and obviously I do all of their scheduling and do their elective time. And it's just kind of, it can be quite a bit over the year. And if I'm not sort of organized and keep on top of that stuff, it's stressful for me, and it obviously is not great for the fellowship experience. Negotiation, I know this was something that was already mentioned by Erin. I find myself doing this a lot more than I ever expected. And as Erin already mentioned, sometimes I am fighting above my weight class. And being able to be a skilled negotiator as a program director, whether you're a fellowship or residency, is really important. In terms of, this is a difficult skill. And I think one of the ways that I have kind of learned to do this is actually by taking classes and courses on negotiation. And I've sought this outside of medicine. Before I went to medical school, I was a consultant and had the opportunity to sort of gain some negotiation skills during that process. And it's one of the things that we don't teach or learn in medicine and focus on very much, but I think it's absolutely critical. So I would definitely seek opportunities to learn about being a negotiator and how to be an effective negotiator. And if you need to go outside of medicine to do so, absolutely do, because surprise, we don't do everything to the most amazing caliber in medicine. And sometimes we can learn things from other professions like lawyers. And then finally, salesmanship. So this is probably the skill that I was least anticipating needing as a program director and for fellowships. But this is really how we get people into our fellowships. And so I have to be an incredible saleswoman to get people to come to cold Michigan for a year to learn how to be an excellent abdominal imager. And I have to kind of encourage people to understand that the Midwest and what you see in the media about the Midwest is not necessarily true. We have some tropical blue waters of our beautiful lakes here. And I mean, Ann Arbor is a lovely town, but not only just selling the fellowship to outside applicants during recruitment season, but basically over the entire 4-year experience for our residents, I am a salesman every single day. And I think when I go to work on a regular, teaching service, I am thinking, how can I get this person interested in abdomen? How can I show them that this is a really fun specialty, and that having adequate training in it really makes a difference between a successful and happy career. Because for our fellowship, I think there's a fair amount of bias that you don't need to have extra training because we got great training during residency. But hopefully anybody that has read high-level abdomen, whether it's rectal or pancreas or whatnot, realizes that's probably not the case. But I do find myself having to be a salesman a lot more than I was expecting as a program director for my fellowship. And I know that it sounded like Erin had some slides for resources. I'm just going to go ahead and put mine up there. They're not like particularly robust, but I really think that professional development through societies is one of the key ways that you can build these skills. And they may not be labeled as skills for program directors, but they might be leadership courses or communication workshops or mentorship workshops, which frankly, like that is what we are doing as program directors, whether you're residency or fellowship directors. You are mentoring these residents or fellows to, their next professional step in the ladder. And then having difficult conversations is another sort of offering that I've seen in a lot of professional development opportunities through societies, either at seminars or meetings and sessions. And these are all kind of things that I would focus on at your offerings for professional societies. Finally, mentorship and thoughtful glide path opportunities. You know, sometimes when you become a program director, it's not by beautiful, thoughtful design. It is you are the brave soul that is stepping up to the task. But if you have the opportunity to have a glide path into the role, whether that's through an associate program director role for a kind of an onboarding time period, that can be really, really helpful. And I'm very grateful to have Kate Maturin, who was the program director for many, many years for abdomen, was actually a program director when I initially interviewed at my institution for fellowship. I'm really grateful to have her ear and to be able to bounce things off of her and get advice from her. And even though sometimes I don't take her advice because I'm a different program director, I'm sort of evolving the fellowship to my vision. It's super helpful to have an experienced person that I trust and value their opinion to talk about some of these issues. And if you're in a situation where you don't have that opportunity, then I encourage you to engage through APDR or through your society. So we have Society of Abdominal Radiology, and we have a program directors and abdominal radiology group, and we offer our own programming and sort of mentorship opportunities. And I encourage you to think about reaching out to other institutions because you may find somebody that would be more than happy to mentor you in sort of program director related issues. And I think that is a super high value because you can get that experience from an external institution and sort of get away from the groupthink, which is very common when you've been isolated in a single institution for a while. So that's all that I have. Hopefully I didn't take too long. And I too am going to share my email just in case anybody has follow-up thoughts or questions after the webinar. Thank you.
Thank you, Jessica. Another excellent presentation. Thank you to the panel. I think that this has been a great starting place to have some further discussion. I'm just going to take this opportunity to summarize some takeaway points that I sort of heard as common themes through all three talks. One is negotiation, communication, organization, approachability, and to have a lawyer as either a family member or friend. So I think that those are pretty good takeaway points. I want to delve a little bit deeper in the absence of questions at the moment into a couple of things that I heard some of the speakers talk about. One that I thought was interesting is the approachability. And there's, a lot of talk out there about likability and approachability and gender and how people are perceived. And I think approachability has been impacted to some degree by burnout and by overwhelm. And how do, you've all talked about approachability as being important. How do you get that back when you're feeling like all you want to do is go and hide in a room and not talk to anybody because you're just so overwhelmed?
I'm happy to jump in on that one. I think this was something that Erin talked about. One of the biggest evolutions that I've had over my time as program director is kind of taking back my own personal work-life balance. And, I was somebody that I've lost 45 pounds in the last 8 months and have started working out to the point where this is my time. And I basically put it in my calendar and this is 4 to 5 hours a week that are my time and it's non-negotiable. And that has had such an enormous impact on my personal presentation to the world that I will never go back. And I hope that I'm able to kind of use that as a good modeling opportunity for my residents and fellows as well. But I think that before I sort of went on this journey, I was getting to the point where I heard a fellow say this once, Jess works so hard. And I was like, I do, but I don't want it to be the primary thing that my fellows think about when they think of me about approaching me. It's Jess works too hard. I want them to think Jess works hard, but she can handle it, because I know I can. And I think because I've set myself up to have a little bit more work-life balance, I am much better at handling the daily insults of being a program director, if that makes any sense. And then honestly, when all else fails, you have to walk a fine line between being a friend and a boss to your fellows or to your trainees. But at the same time, I do try to make sure throughout the year, I do little check-in things with them to make sure that they understand hey, I am here for you, that my job is not just to schedule you and to scold you if you do something wrong. And so, I do cheese nights at my house and we do a welcome barbecue during the summertime so that everybody kind of sees hey, I'm a normal human being that has corgis. And it's not just that I am the person in the hospital that you see. And I think getting outside of the hospital and having some social interaction with the trainees can be really, really powerful.
Absolutely. Yeah, I obviously totally agree with that. Those moments, it doesn't even take a lot. It can be very impactful. And the issue of burnout or needing to take some time, it can be really hard to address when you want to also maintain that openness and availability. One thing that has helped me is to be, and this word is like overused, but to be authentic. So if I didn't get enough sleep last night, or I'm having a challenging day, I usually actually do, say that if people ask, how are you doing, including to the residents, because I want them to know that it's also okay for them, to say when something is stressing them out. And so that they actually have been fairly protective of me, so that they know it's fine to share some of the ups and downs. That's part of the whole process.
Yeah, I would echo both of those things. Regarding work-life balance, I remember I was here for a number of years, and we were rounding on patients, and as we spoke with some staff that were there, that were on the floor, and then we were walking away, and I think it was some staff and some house staff, and one of the residents, not our residents, of surgery or something, said to one of the other residents, "Was that a fellow or an attending?" And first I was like, thank you. I have a very regimented skin routine, so I appreciate that. But I, they thought I was walking away. They didn't think they heard me, but they said that. And then the other person said, "No, he's got to be a fellow. He's here way too much to be an attending." And I was like, "Oh, sick burn, kid." And he was right. I spent a lot of time, and I could be a fellow because of how much time I spent here. But regarding trying to having a work-life balance and being approachable, I probably am not great at demonstrating appropriate work-life balance. I do have some hard and fast rules, like when I go home and I'm not on call, I'm home. And I very rarely take evening phone calls. I'm very heavily involved in SIR and ACR things, but I try and make sure that things end when I get home, so that my time is with my family. So how I demonstrate that to trainees is I talk a lot about my wife and my daughter at work. I tell stories about my daughter's a lunatic, and I tell lots of stories about her, and I want to hear their stories too. And so when there's downtime between cases, that's when I interact and just make sure that they know that it's okay and good to talk about things that are happening at home, and to share those things. And I think that helps.
Yeah, I agree. I definitely think that it's important to have those kinds of personalized, it makes you human conversations. So all of my trainees knew that I actually beat Erin. I have 2 kids, 3 dogs, and 5 cats. So
Wow.
I have the
Blown away. Outstanding.
Lots of pictures of all of those around. That's great. Great advice, guys. So I still don't see any questions in the chat, so feel free for our audience members, excuse me, to put them in there. You all touched a little bit on not having a lot of patience, and I certainly share that. But how do you, again, going back to the pandemic and all the overwhelm and things being so much harder to get done these days, anything that used to take you 5 minutes now takes you 4 hours. And gaining that level of patience that we had before the pandemic, I think, that was a process in itself. But how do you get it back now that things are that much harder and more complicated and you have to rebuild process? What do you do to do that?
Yeah, that's a tough question.
We can go back to talking about the cats and dogs.
If only we knew. Yeah, I think that is hard. For some of the more mundane things, I try to build it in, meaning if I want something done, a month and a half from now, I try to send out, those reminders like super early on, because I know that people will delay it and all of that. And if I really want it on Friday, I'll try to put the due date on Wednesday, that kind of a thing too, to put a little grace period in there. And that way I'm just less annoyed if things come in a little bit late. And for Luke touched on this too, for bigger picture things, and this gets back to knowing yourself and perhaps like doing some of the leadership coursework that Jess mentioned. Having some self-awareness and understanding of your own tendencies can be really helpful. Like I know for some of those like leadership, what kind of communicator, what's your personality style, type of survey type items, I tend to fall into like the driver category. Like I'm really pro change, and that's partly, why I'm impatient for some of the larger things. So it is something that I've just actually tried to work on by using some of these other tools to, I don't want to say curtail my expectations, but to at least have some awareness that maybe not everyone is ready for some degree of change. And I need to kind of be aware that people may take some time regarding like change management.
I think one of the more powerful pieces of advice I got from a mentor is I think that naturally people who are like natural go-getters or learned go-getters are the people that gravitate into these positions of program director for fellowship or residency. And I think for me, a big learning point was you cannot have expectations for others that you have for yourself. And that was, I mean, that's honestly like a big learning point as a new attending as well. Is like, the things that I was finding myself losing patience over, to me, it's like a no-brainer thing. But I also was like an adult and had a job before I came to medical school. And many of our residents and fellows have never had an employment opportunity, like a real employment opportunity before this experience. And so sort of like checking myself and remembering not everybody comes to us from the same life experience that you did, and you may have to help them understand that, I think is a very helpful thing. And then the other piece is I also had to learn to have a lot more chill than I ever did before. Like I am not a chill person. And I think as a program director, I have to learn to be a little more chill about things. And it is not the end of the world if, we push things back a week, or people have not, I have to send a third email, or if I have to talk to somebody in person because that's more powerful than email and they don't check their email, I will make an opportunity to do that and do it without kind of being angry. And so I think that those are the things that have kind of helped me as strategies, but it is obviously really challenging.
Yeah, I would completely echo the don't put your expectations that you have for yourself on others. That has been that really spoke to me, because I do that a lot. And I've realized that I do that, and I've tried to shift that, but that's a very, very good point. The other thing that I would say would help with my patience is, one thing that I always say is that the hard things are hard enough. You shouldn't make the easy things hard too. Like doing residency interviews and trying to pick applicants. That's hard. Like that's always going to be hard. That will never be easy. Doing research and developing a grant. That's always going to be hard. There's no way of getting around that. But you shouldn't make the things that should be easy hard too. So don't take on onerous tasks, or learn how to automate, or learn how to delegate those easier tasks so that they don't fall to you, so you can focus on the hard stuff. It's kind of like when APPs, and MDs for that matter, talk about practicing at the top of their license. As a program director, you should be trying to practice at the top of your license, and doing the hard stuff of the program director, and not doing all the minutia.
I think that resonated really well with the whole panel, Jess, that I think we do tend to expect the same performance that we have of ourselves. And we definitely are type A's as program directors. So that's a very good wake up call, I think. So we only have about 4 minutes left. So I'd like to ask our panelists, in the interest of time, to just give me a 30-second wrap up of your key points that you'd like this audience to take away. So we can go ahead and go in the order that we started with. So Erin, you want to go ahead?
Yes, absolutely. Actually, I'm just going to quickly share my screen so I can share my resources, if that's okay.
Yeah, absolutely.
I'm going to capture it that way.
And
So
while you're doing that, I would say just there's actually there's a Coursera, if anybody's familiar with Coursera.org. There's one from Michigan that I did, negotiation skills, that was fantastic. And my 11-year-old listened to it with me and she uses it on me, but it's a really great course and I would recommend that one.
fantastic. I love that. Yeah, using these other spheres of knowledge is really incredibly impactful. Yeah, a lot of our best resources, of course, are other radiology PDs. Do not hesitate to reach out to folks. Program coordinators often have a large body of knowledge, and sometimes it could be a program coordinator in a different program that could be helpful to you. I've reached out to a lot of folks over the years, especially when I was first starting out, and people are often overwhelmingly very happy to share their knowledge. Your program directors in other specialties in your institution can have a lot of great ideas, and some other resources internally, depending on the size of your institution. There are a ton of things online. Of course, APDR is a wonderful resource. But the ACG-Me, one thing that I didn't really know about for quite a while, they do have a lot of toolkits, videos, things to like help a struggling learner, tips on these like very difficult types of items. So take a look at what they have to offer if you've not already, and of course our other societies as well. When it gets to coursework, I would certainly encourage program directors to look at some of these other courses that you may not consider right off the bat, like the AGWAR has the management program, which is excellent. AAMC has programs, and for women in radiology, the LEAD program is also another fantastic resource. For those of you who enjoy reading, I just took some screenshots of some of the things that I have enjoyed, which have helped me think about how to approach a whole range of challenging situations in radiology. And here's a few more. My husband says it's kind of insane the number I have, but I'm always looking for more. So if you have great recommendations, please email me some books. So in the interest of time, I will just stop there. But for a summary, basically, my message would be to a pause if you have not done this, and know yourself. It's really important to know your habits, to identify your areas of weakness and the resources out there that can help you.
Luke?
Is that like a almost a Lego build of the first CT scan?
Yes, isn't that great?
That's phenomenal. I really
Thank
like
you.
that.
Thank
Yeah.
you. I'll stop.
So yeah, I guess my kind of parting words. So I, as I mentioned earlier, I have a daughter. She's 9, and I've seen every Disney and Pixar movie from like Here to Eternity multiple times. And one of the ones that really resonated with me was Inside Out. So if you've seen that movie, there's the premise in it. The premise is like it's inside of this little girl's head, and how her personality develops. And one of the things that it hinges on is these core memories that you develop over time. And I'm sure you all have these core memories, especially from your training, in which you had a good or a bad interaction with a faculty member, or more specifically with your program director. So something I try and keep in mind is that I am creating core memories for these residents. And I need to make sure that I'm creating positive core memories, not that I'm going to be always cheery and optimistic and enthusiastic. Sometimes as Jess alluded to earlier, sometimes I need to be their coach, but I need to be progressing and moving them forward. So I sometimes like to think that maybe I'm not creating core memories, because that puts less pressure on myself. But I had a resident that had a very difficult time with some very significant issues in her life outside of the hospital, and required a lot of work from me. And this actually involved some disciplinary things. And I remember when I was having this conversation with her, and I'm not good at kind of confrontational issues. I'm very much from the Midwest. I actually grew up very near Ann Arbor. So I'm so Midwestern that one time my dad almost told me he loved me. I'm that Midwestern, and it's hard for me to have those conversations. And I was in the middle of the conversation. I was like, shit, this is going to be a core memory for her. And she did come back, and she said, I remember that conversation we had. And I was like, oh, shit. And she was like, I thank you so much. And so I actually said the right thing, but I was very grateful that I actually handled it okay that time. But there are other times where I haven't. And I definitely want to make sure that kind of moving forward. So just to future PDs, I would say definitely know the impact that you're having on these residents and respect that. Oh, and have fun. It's a fun thing, and have fun doing it.
It is. I honestly think I have an awesome job, and everybody's always like, oh man, why'd you take that role on? It's such a cool thing to be able to do, especially kind of like I said, putting those final decorations on our wonderful residents that come in as fellows. But I guess I'll end by saying, when you're a program director, regardless of residency or fellowship, follow airplane rules. Put your oxygen mask on yourself before you put it on others. Piece number one, you got to take care of yourself before you take care of others. And you have to take yoga. You have to be flexible. You have to just kind of make sure that you're able to pivot and respond, because you're going to have so many different personality and learner types in front of you over your tenure as a program director. And it really requires a lot of flexibility on your part as program director. And Erin went over some really wonderful resources to give you those skills necessary to support that activity.
Fantastic. Well, thank you, everybody. I think this was a phenomenal roundtable. The recording will be available on the website at some point. Carolyn, do you have some parting words?
No, just thank you so much, Tara, for organizing this fantastic panel. And thank you to the fantastic panelists, as well as our APDR support staff who helped us organize all this. So thank you, everybody.
Bye,
Thank
everyone.
you
So much. It's a
Bye.
pleasure.